Hi everyone, today I have a patient named Tom, 54 years old, came to the hospital with a complaint of chest pain. Tom is currently working in a high stressful area in the airport. Tom recently went to his GP and his GP found his blood pressure is 174 by 100, which is high, and his blood test seems to not be normal. And today I'm discussing in this video that how you would assess the patient who present with the chest pain, and to identify how you would determine if the patient is cardiac in the future. So first we have to do assessing a patient with chest pain requires systematic approach to determine the underlying causes of the pain. Here are the steps I would to take to assess the patient with chest pain. So first one is obtain a thorough medical history. If the patient having any medical history related to high blood pressure, related to any chest pain, and any family member who having stroke or heart attack, so like this. So in this, the medical history should include the onset and the duration of the chest pain, the location, quality and severity of the pain, and aggravating or relieving factor associated symptoms such as shortness of breath, palpitations, nausea and diaphoresis, and any past medical history. So the next step is perform a physical examination. If a Tom having chest pain, so the nurse or the doctor or the any medical professional should perform physical examination. So in this point, the physical examine should include assessing vital signs such as blood pressure, heart rate, respiratory rate, and performing a thorough cardiac and pulmonary examination. So this is the physical examination. The third step is conduct a electrocardiogram, that is ECG. If the patient having chest pain, this is the best method to identifying why patient having chest pain. So an ECG can quickly identify any cardiac abnormalities such as arrhythmias or ischemic changes. So fourth one is perform blood tests. Blood tests can also help evaluate for any cardiac enzyme elevations indicating myocardial injury. So the fifth one is conduct imaging studies such as a chest x-ray, echocardiograms can help identify any structural abnormalities in the heart or the lungs. The sixth one is consider other causes. It is important to consider other potential causes of chest pain such as gastrointestinal issues, musculoskeletal pain or anxiety to determine if Tom chest pain is cardiac in nature. The medical history, physical examination, and ECG are the most important tools. The onset of sudden and severe chest pain, that is crushing or squeezing in nature, radiating to the left arm or jaw, associated with shortness of breath, nausea, vomiting or diaphoresis, and occurring with physical exertion or emotional stress, is highly suggestive of a cardiac origin. Additionally, the presence of abnormal ECG findings such as ST segment changes or arrhythmia can further support a cardiac etiology. This is the main point which the nurse should have to keep in mind while the patient having chest pain. So this is the point that doctor and the nurse should follow this point. This is important and very beneficial for identifying if patient having chest pain, that it would or it will lead to the any heart diseases or any heart stroke. So this is the points you should always keep in mind. I hope this video helpful for everyone. Thank you for listening my video. Thank you guys.